Aloha, gang. Dr. Russ Rosen here, and welcome to Rosen Interviews the Greats. And we do have one of the all-time greats. That is Dr. Andrea Parisio-Ferraro. Dr. Andrea, welcome aboard.
Thank you so much, Russ.
Oh my goodness. I've been looking forward to doing this for a very, very long time. So Dr. Andrea and I met, I believe, in 2009. I was speaking in Australia. You were working with my good friend, Dr. Angus Pike, and we got to meet there and we were doing some coaching back at that time. You ended
Yes.
up going out on your own and you have this thriving mums and bubs practice. So in Australia, everyone knows that term. The rest of the world, maybe not. Tell us about your amazing practice and yourself.
Oh, wow. I graduated in 2007 and I had a bit of a rocky start, as I guess all associates do. And I lasted in my first associate for 6 months. And that's when the legend Angus Pike kind of, grabbed me under his wing, helped me out, introduced you and I together, and the rest is history. We did obviously a lot of coaching, you and I, for I would say a good 2 years strong. And then we've been coaching ever since then. We always touch base, and I'm always so grateful for your help. In terms of the practice, I always wanted to work with mums and bubs. I always believed that everybody needs chiropractic care. I just knew that I wasn't the right person to provide it for everybody. So that was a real struggle that you helped, pull me through and just let me focus on my niche and what I love doing. And yeah, the rest is history. We opened up our new clinic during COVID, which was, a tricky time for us in Australia to navigate, as the whole world was. And yeah, I guess that's me in a nutshell.
Yeah. So you've been, it's an interesting thing. So mums and bubs, for those of you
Mm.
who don't know, that's moms and babies.
And babies. Yeah.
And
And kids. A patient asked me the other day, she's like, at what point are you going to stop seeing the older kids? Because right, I've been doing this for 17 years. Some of the little kids that may have started when they were 3 are in university. And that's something that you and I will need to chat about, because I haven't thought about an endpoint.
right, right.
But
Yeah. So when we look, just for those of you, mums and bubs, mums
mm,
is moms and bubs is
yeah,
babies, kids kind of thing.
yeah,
And
yeah.
originally, when we were playing with it, you were going, I really love working with these folks. And it was, the headspace of I have to help everybody. I love working with
Mm,
everybody, blah, blah, blah. But what I really love is this. And originally it
yeah,
was, okay, mums and bubs and their families. And then that
yes,
turned into, I don't really want to do it. I really just
yeah.
mums and bubs, which you've been able to pull off and have more demand than supply for several years. So tell me, and it's interesting because for the last several years, maybe, every quarter or so or something like that, you'll give a call and you'll say, got to get on with you. And most
Yeah.
of what we're dealing with anymore, because you're one of those humans that actually do what you say you're going to do. So you're communicating well, you're getting the message out there, you've got great flow, you're really doing everything right. And then mostly we're looking at how do I handle the
Fine.
demand? I
Yeah.
have more demand than supply. I'm feeling stressed being, months out before a new patient come in. There's so many of those kinds of things that come up that we laugh about at the beginning when I talk with doctors when we start coaching and I go, look, you've got problems now. I don't have enough money. I don't have enough patients. I don't know what to do, blah, blah, blah. But once you're really full, there are a whole set of new problems, which, you've been handling for quite some time. So how do I handle the demand? And then how do I have a balanced life? So those are things that really come up for when we've got this kind of demand.
I think that's still a really tricky one for me. And there's some weeks where I'm like, I'm a killer chiro. I've been in practice, doing all the right things, and I feel guilty because the kids probably haven't had, the best of me. So I think that juggle I've just learned to accept is always really hard. The key thing that you taught me is boundaries and making sure that I look after myself first. And I think that is such a pivotal key to success as well. Because if I'm looking after myself, I'm showing up such a better, in tune, on fire chiropractor for these people that, then they will want to tell their friends. And it is word of mouth, especially with babies. It is 100% word of mouth, like any practice is really. But that's a key because if you've done a good job and the parents trust you, they're going to want to refer their friends. And unfortunately, still in Australia, a lot of people are still worried about chiropractic and kids. And they're still like, are you going to crack my baby? Are you going to do damage? So there's still those hurdles. But yeah, I guess the juggle is still always going to be there. It's just putting in those boundaries, like you said. You need to work these hours, be really clear, 3 hour blocks, and all of that you've helped me with has been, a testament, really.
Yeah, and really blocking out these are the days and times I
Yeah.
do these things, and I can have other people, I can pay someone $30 an hour because I'm
Mm.
$1,000 an hour, and I can pay people to do these other things. And you've been
Yeah.
really good about that. And it's, you know, I don't know if it's politically correct to say or not, but look, it really is different with mom chiropractors. I am a dad.
Mm.
When my children were younger, they were a massive part of my life. I had divorced from my wife, so I was there, 3 to 4 days a week with my kids. With that
Mm.
said, it's just different. It's just different for moms, and it's not always easy, but it is what it is for you to have the life you want.
I also came to terms with that as well and accepted that the mum will always have to, wear the load. And as much as you can put, like you said, I have a cleaner, I have someone who, helps me with the clothes and the ironing and all those things as much as I can offhand. So I can just be really focused on quality of time with the kids when I'm with them, quality of time of patients when I'm with them, because otherwise it's all just going to fall apart if I try to do everything. It's not possible. And yeah, unfortunately, it is really tricky, but you can make it work if you've got clear boundaries, in place.
Yeah, which you've done a great job at. So let me ask you this. Why would a mom want to see you? Why would a bub want to see you? In essence, why would the mom want the bub to see you?
I love what I do, and I truly believe that if every child has the opportunity to have a chiropractic adjustment, a chiropractic assessment, it can change their life. I've seen kids that have had lower muscle tone walk and do great things, kids with autism, all these amazing changes. And I guess because I'm so passionate and a mum myself, I can relate. I think that would be the most, important part of the picture. I can understand when they're having bad days, whereas, perhaps it might be different for
Yeah.
another chiropractor.
So how do you help the moms recognize that it's not only safe, but there's value? Because in Australia, it is worse than most places where you've got that negative brand equity.
Yeah.
So how do you handle that?
I guess I'm just really honest. That's a really, I guess that's a hard question for me to answer because I don't think about what I'm doing when I'm in the process of doing. I just do an assessment. I link the dots with Touch, Tell, Ask, Teach that you've taught us so well, and just explain that this is what, would be my recommendations. And I also have to hold no judgment. That's been a really important thing for me to learn that as much as I'm a mum and these are my recommendations also as a chiropractor, that mum has to make the decision that they feel is truly best. And that took me a really long time to master that non-attachment in their acceptance or non-acceptance of care.
Yeah. And so for those of you who've been listening to me for any period of time, I'm always talking about headspace and procedures.
Mm.
And we talk about the certainty, not real certain, white belt breaks their hand, black belt breaks the brick when we have absolute certainty. And then there's the procedures. How do I do a consult? How do I do an exam? How do I do a report of findings? How do I do
Yeah.
regular visits, re-eval, re-reports? It's something that you and I have worked on off and on for many, many years as you keep growing and evolving. But, you know, for sure, you have tremendous certainty. You have tremendous certainty of the value that you bring to the table. And after so many years of helping so many people, it becomes pretty simple, right? And that's the black belt
Mm,
breaking the brick
mm,
because it's like I've seen hundreds of these people. I've
yeah.
seen, the latching issues and the, autism and all the things that you're really able to help so many people with. Your certainty is such an incredible piece of the puzzle for those of you listening, going, how does she do it?
Mm,
It's her,
mm.
she has tremendous certainty, but she also doesn't just um, rest on that. You really work hard on your communication strategies. You work really hard on making sure that people are able to get the value of what you do, right? It's not just dumb luck.
No, well, of course, it's working at it. And it's funny, I actually found my very first initial recordings and reporter findings, and I was cringing my way through listening to those, even now, so many years out. But it's just, it's practicing and realizing, you know, your I don't want to say scripting in a bad way, but all of your procedures that you allow us to learn helps us then fine tune. But you've given us an amazing base that even if you didn't fine tune to yourself, you could say it and it just would work so effortlessly.
Yeah. Yes. And again, that's the thing. I talk a lot about you'll never be as good at being me as I am, and vice versa. You've really taken it and made it your own, which is you've Aussieized it, you've
Mhm.
Anglicized it, which is why it really works for you. The other thing that we've played a lot with that I know, and for those of you who are listening to this, when you're on this end over here, which is, I don't have enough new patients, I don't have enough money, nobody understands, nobody sticks around. You can't quite understand what happens over on this end. But on this end, when you are that busy and you are that full and you have more demand than you can handle, and now that's an issue of how to
Mhm.
handle that. This whole thing comes up around with the patients, and it is tell the truth, the whole truth, and nothing
Mm,
but the truth with absolutely no
mm,
charge. And
mm,
it's an
mm,
interesting thing because over here, we feel like we need them more than they need us. And the
mm,
reality is, it's not true because if they don't get adjusted by you, they don't get care by you, their
mm,
whole life can be screwed up, whereas you would miss one patient. Once you get over here, it's a whole lot easier to be able to look at people and go with
mm.
no charge. Look,
Yeah.
here's the truth. These are the consequences. You've got to make the decision on your own. And it's easier, but interestingly enough, it's not as easy as we might think because we still, at least my experience for myself and some of the things we've dealt with, we still have that challenge of really wanting to help everybody,
Mm,
even if even if they don't.
mm. Yeah, definitely. I had a patient last week that, I explained that I don't do any manual adjusting and she's like, "Cool, I'm happy to try." And then she did one session and then she's like, "It's actually not for me. I want to go back to that." And I was like, "You know what? I'm going to send you love and that's okay." And we had a chat last week about a patient that, I was running late and you're like, "You just need to accept that you can't help her at that time." And it takes a lot of time. I'm still working on it, as you know. And I think we will forever work on it when we deal with, patients and people. But
Yeah,
I wish I had the clarity that I have now back when I started because that would have helped so much. I would not, it would have helped me grow my practice faster. That's for sure.
right. Yeah, it's just one of those things. It's like they say it takes money to make money. If I had this level of certainty back then, my practice
Yeah.
would have grown so fast, but I had
Yeah.
to go through what I had to go through to get this level of certainty. It just is what it is. But for those of you who are listening who are moving in this direction,
Mm,
it is. I wish these problems upon you. I
mm,
hope, that these problems disappear and these new ones show up, but there's always something we're dealing with,
mm,
right? There's always, home and Homer, there's always good and better. And it just is, as long as you're trying to continually grow and evolve, which is
Yeah.
one of the things that I love about you, because you're always growing and evolving, right? You're always checking yourself. Can I be better?
Yeah.
Right? Almost to a fault. Like
Yeah.
it's a real big thing, but
Yeah. Yeah.
it's
Yeah.
why you're so great. It's why, again, and you said this really wonderful thing. You said that, you're 100% internal referrals. Is that true?
Pretty much.
Yeah,
Pretty
okay.
much.
And then
Yeah.
you said, yeah, like most practices. That's not like most practices. Most practices get very few referrals, and most practices are doing all kinds of things to bring in crap patients that they don't really want. You bring in your perfect niche market. You have your ideal patient, and that's exactly who you bring in. And those people are happy and they send in others, right?
Mm.
Which is what we want for everyone. But I
Yeah.
didn't want to just let that go because I'll bet you less than 10% of the practices out there are like that. I mean, it's really far and few between. So for those of you listening and you're thinking, can it really be done? Well, you're looking at her, right? I mean, she does it and you can do it too. Any other thoughts? Any things you can share with the listeners about what they could do to grow, to have the kind of practice, to have the kind of success that you've been able to pull off?
I think being really clear with your purpose and your vision and really sticking with that and sharing that with patients as well, I think is really important. Constantly doing the work on yourself. You made me read that book, Byron Katie. I've still got it. It's one that I reflect on, one that we chat about all the time. I think it's sometimes it can be your own detriment to look within. Sometimes we can look within too much, but it's so key and pivotal, especially with that headspace, getting that right on track, doing the work with you. I mean, that was fundamental. Back then, I was a new grad. I'm still checking in with you how many years later, almost 18 years in this profession, and I still need a coach. That is so important. Just having someone you can check in, someone else who understands a profession. And just yeah, just doing the work, doing great adjustments, ensuring that you're showing up with intention. The patients can feel it. They know if your hand, the minute you touch your hands on their back, their spine and nervous system, they know whether you're on or not. And I think that's really important as well.
Yeah, absolutely. So just again, quick thoughts on this because I know Andrea so well for so many years. Um, Certainty, an incredibly important piece of the puzzle. Between her ears, the clarity is palpable and it isn't rigid. It's flexible. You're always growing, you're always
Yeah.
evolving, you're always looking at and what now kind of thing. But there's clarity. And then the procedures of what am I going to do to make that
Mm,
happen? You're also huge at course correcting. More often than
mm,
not, when you do call, when we do talk, it is
mm.
this just happened. Why did that happen?
Yeah.
Something happened that I didn't like. How do I not
Yeah.
have more of that?
Yeah.
So,
Yeah.
yeah, versus just throwing that out, it's no, I'm going to
Yeah.
correct, which
Yeah.
you're really good at. You've been so great at getting clear about the kind of practice that you want and really making that happen. I remember the first time we spoke about it, you were saying, is that really possible?
Mm.
Could I really just have a practice like that? And it was like, oh, yeah, absolutely. Here's how you do it. And you were on it immediately, right?
And at the start, it can feel really awkward because you're like, I had to say no to a lot of patients too. I know that sounds crazy, but it was like, no, you don't fit my ideal model. And I'm not going to be the best chiropractor for you because I don't love manual adjusting. I don't love, sports. That's not my passion. Because the minute you nurture your passion, just the rest just takes care of itself.
Yeah, absolutely. So if somebody were sitting on the fence right now and they were
Mm.
thinking, I'm thinking of working with Russ, what would you tell them?
Oh, without a doubt, 100%. How many years in? Well, if it was 2009, a million years in, I'm not even going to do the maths, but I still love checking in with you, working with you. It's never a day that I don't need some guidance and support, and you've always been there, just helping you get clear, even if it's just getting clear of your vision, even if it's just learning the touch tell ask teach, if it's learning the procedures and the scripting, all of it is pivotal. And I wouldn't be where I am today without you, Russ. And you know that because yeah, I love and adore you.
Yes, and you know I love and adore you too. All right, beautiful. So thank you so much for your time. We've been trying to get this together for months. So we finally
Yeah,
got together. I
yeah,
want to
we've
thank
done
you.
it.
I know that you're going to
Thank
inspire other
you.
people
Hope so.
to greatness like yourself. So thank
I
you so
really hope
much.
so.
Yep, as
Thanks,
always,
Russ.
Dr. Andrea and myself, as always, much love and aloha. Bye, gang.